just about to go off and do an outreach with the local health worker, plus our English doctor and nurse who are here visiting to help us out.
That's the patient house we're going to see.
Uh-huh.
He has a cut on his leg, and that's his house.
Okay.
There might be splinter inside.
Yeah.
Okay.
Still.
So just give it here.
Yeah. Can he walk outside?
हिँड्नु सक्छ बाहिर?
It's
quite sore.
We'll help.
बिस्तारी.
You can sit down outside and we can maybe...
बिस्तारी बिस्तारी. Slowly. It's quite sore.
I know, I'm gonna have to clean it though. The cloth on it?
Yeah.
Right.
So do you think there's something still inside there?
Well, I don't know, but the patient thought there is, and it could well be. So what we'll do is wait for the local anaesthetic to work. Then we'll give it a really good clean. We'll have a look inside and look around and see if we can find anything.
Does he need to go to Darjeeling, or what do you think?
I think he needs to go to Yuma and have it surgically
Well,
opened.
yeah, it's a difficult call really, because he needs to have that formally washed out somewhere.
Can't we put the syringe here and just
Well,
saline?
we can give it the best washout we can and give him some antibiotics, but you just have to be aware that he could get an infection in his joint. I mean, we can do the best that we can, definitely, and give him antibiotics.
Okay.
Tom, do you not think that the likelihood of it getting more infected is pretty great, and he's going to end up going eventually anyway? Would it not be better to maybe get it?
Yes and no.
Dog.
The dog.
You see all this fat here? That's all probably from the joint. Well, look, let's wash it out
and dress it anyway, huh?
and we'll have the discussion afterwards with him and see what he wants to do as well.
Yeah, tomorrow.
Yeah, well, you can't go tonight anyway, so. The discussion is whether he needs to go for a washout serology. Will they do that in Bijanbara?
Nope. Bijanbara does the same thing that we do. Actually, not as we.
Yeah. I mean,
Wrap it in your glove and then just fold your glove over the top of it.
what would he think of going to Darjeeling, this man?
Yes, that's his wife.
Yep.
And that's all.
Okay.
And the small kids.
Yep.
माथि बजार गयो भने के हुन्छ? घरमा फेरि कोही हुँदैन हैन? कोही त छैन हाम्रो.
Something they need to understand, Suraj, is that it's not going to, even though we've done this now, it's kind of first aid measures, and he's not going to be able to work for quite a while with that anyway. We'll see. It's going to be, if nothing else, very sore. And there is, even with antibiotics, still quite a high chance of it getting infected. So
what we say is, why don't we just see how it goes? What we'll do is, today is gone.
Yes.
And tomorrow.
it's a weekend.
No. Yeah, it's a weekend, but still, there's a taxi tomorrow from 11 o'clock from here. So they might just come at 9 o'clock in the morning.
Yeah, sure.
Yeah.
That sounds like a really good idea.
Yeah. And if it's healing, you can stay. If
Okay.
it's not,
Okay.
then we can just 11 o'clock.
Yep.
And after we've gone through, it's like you'll have to just keep checking, because if it looks like the joint's getting infected, he will still have to, even with antibiotics, he will have to go and, to hospital. It may be that by tomorrow we can't tell anything more, because it's still very early, but maybe in 3-4 days' time.
Okay. Okay.
Yeah, and you'd be able to tell, wouldn't you, if it was getting infected?
Yeah.
So
That'd be a
if
big
it
red
got
hot
big
joint.
red and hot, if he started to feel more unwell, there was lots of pus. Yeah.
Okay. Yeah, we will do that.
We've come back the next day to look at the man's leg, and he was actually bearing weight on it, which is a very good sign, and it does look slightly better. I'll have a closer look.
Oh,
Okay.
just gently, just to see. And then you get a feel of what it's like to... Yeah.
Close, doctor.
Okay. So close them up slightly.
Yeah, a little bit close.
So close it.
Yeah.
And then, no, sorry, close them. Yep, and then just see how far down you can go. And that, see, it's quite a deep hole, isn't it?
I think it's hurting.
Yeah. Now, dig it out.
Yeah, you can take it. It's just for you to get a feel of how far down that goes. And then you can, what you can do is with one
No,
hand,
but we don't know how far it's punctured. I think it's probably about
with one hand you
a few
can,
inches.
Make a...
if you fill up the syringe,
Yeah.
and then with the other hand open up the hole slightly,
Yeah.
and then you can wash it out with this one.
We're back to the man with the knee. He's come down to the clinic for a redress, and this is day 6 since we first saw him. Since then he has fallen over while carrying on work on the farm, which caused the leg to swell up, but now it's looking pretty good and he's got no pain, so we'll have a quick look and see what it's like. Let's just come wider, I think. Yeah, well, with any luck, and he's still on antibiotics, isn't he, for now?
Yeah.
Well, how long will that carry on for?
Well, that will... Kati po weather as had been by. Well, 7 days now, and still might be for a few days more.
I mean, is there any sign of infection there, or?
Yeah, but sorry, it's getting better anyway.
Yep.